Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Please see additional important safety information at the end of this video.
Hi, my name is Dr. Andrew Cutler. I'm a psychiatrist by training and currently the Executive Vice President and Chief Medical Officer of Meridian Research. Previously, I was in charge of several community mental health centers where we work with patients receiving antipsychotic treatment. Historically, there was an expectation that second-generation antipsychotics would greatly reduce the prevalence of or eliminate tardive dyskinesia, otherwise known as TD. However, a recent meta-analysis found TD in 20.7% of patients on second-generation antipsychotics with unspecified first-generation antipsychotic use. For patients who received only second-generation antipsychotics, the meta-analysis found that 7.2% had TD. Therefore, TD screening is important when evaluating patients on first or second-generation antipsychotics. One recent study assessed involuntary movements and possible TD in patients treated with antipsychotics, the RE-KINECT study. RE-KINECT is the largest real-world dyskinesia screening study of its kind. 739 patients were clinically evaluated at 37 outpatient psychiatry practices in the U.S. To be eligible for this study, consenting adult patients must have had a cumulative lifetime exposure to at least one antipsychotic for 3 months or more. Patients exposed to antipsychotics were assessed for involuntary movements and clinically evaluated for possible TD. RE-KINECT featured two-tiered screening. First, for uncontrollable movements, including visual observation by the office staff or nurse. Second, a clinician assessment of involuntary movements and confirmation of whether movements could be considered possible TD. The results of RE-KINECT are enlightening, particularly the overall rate of clinician-confirmed possible TD. Almost 28% of the 739 patients who were clinically evaluated were confirmed as having possible TD. RE-KINECT showed that possible TD can affect other areas of the body, not just the face and head. More than half of patients had uncontrollable movements in 2 or more body regions, including the trunk, upper limbs, and lower limbs. In fact, about 1 in 3 patients were not affected by movements in the face at all. Now, this reinforces the need for routine full-body screenings for uncontrollable movements such as TD. RE-KINECT also showed that patients with clinician-confirmed possible TD had a broad range of underlying psychiatric conditions. Although schizophrenia was the most common psychiatric disorder, many patients had schizoaffective disorder, anxiety disorder, bipolar disorder, and other underlying conditions. Lastly, RE-KINECT demonstrated the impact of involuntary movements. Although a variety of factors may contribute to emotional well-being, generally more patients with possible TD reported problems with mobility, self-care, performing usual activities, pain or discomfort, and anxiety or depression, as measured by the EQ-5D-5L as slight problems, to being unable to perform. This reminds us not to underestimate the potential impact of involuntary movements, reinforcing the need to screen regularly for uncontrollable movements such as TD. This study did not include a formal diagnosis of tardive dyskinesia, instead referring to patients as having clinician-confirmed possible TD. However, some learnings may translate to your TD evaluations and assessments. First, it is imperative to screen all patients treated with antipsychotics for uncontrollable movements, such as TD. It is also helpful to include the entire office staff and nurses in the screening process. The APA recommends screening prior to starting any antipsychotic regimen and every 3 to 6 months thereafter. I generally recommend screening twice a year. Another key learning is the importance of conducting a full body examination. A thorough physical examination can help unmask and identify TD movements beyond the face and mouth. Lastly, consider the potential impact of TD movements on your patient. Discuss if others notice their movements. Is your patient experiencing embarrassment or isolation? It may be important to include your patient's caregiver in their treatment and management plan. Caregivers are often the first to notice signs of involuntary movements. Remember, any patient who has had prolonged exposure to antipsychotics is at risk for tardive dyskinesia. With the help of office staff and nurses, be sure to assess each patient carefully so you can help uncover TD. If you are prescribing antipsychotics, you may have more patients with TD than you realize. Helping patients overcome the challenges of tardive dyskinesia starts with thorough assessment and screening.
Important information. Indication and usage. INGREZZA valbenazine capsules and INGREZZA SPRINKLE valbenazine capsules are indicated in adults for the treatment of tardive dyskinesia and for the treatment of chorea associated with Huntington's disease. Important safety information. Depression and suicidality in patients with Huntington's disease. VMAT2 inhibitors, including INGREZZA and INGREZZA SPRINKLE, can increase the risk of depression and suicidal thoughts and behavior, suicidality, in patients with Huntington's disease. Balance the risks of depression and suicidality with the clinical need for treatment of chorea. Closely monitor patients for the emergence or worsening of depression, suicidal ideation, or unusual changes in behavior. Inform patients, their caregivers, and families of the risk of depression and suicidal ideation and behavior, and instruct them to report behaviors of concern promptly to the treating physician. Exercise caution when treating patients with a history of depression or prior suicide attempts or ideation, which are increased in frequency in patients with Huntington's disease. Contraindications. INGREZZA and INGREZZA SPRINKLE are contraindicated in patients with a history of hypersensitivity to valbenazine or any components of INGREZZA or INGREZZA SPRINKLE. Warnings and precautions. Hypersensitivity reactions. Hypersensitivity reactions, including cases of angioedema involving the larynx, glottis, lips, and eyelids, have been reported in patients after taking the first or subsequent doses of INGREZZA. Angioedema associated with laryngeal edema can be fatal. If any of these reactions occur, discontinue INGREZZA or INGREZZA SPRINKLE. Somnolence and sedation. INGREZZA and INGREZZA SPRINKLE can cause somnolence and sedation. Patients should not perform activities requiring mental alertness, such as operating a motor vehicle or operating hazardous machinery, until they know how they will be affected by INGREZZA or INGREZZA SPRINKLE. QT prolongation. INGREZZA and INGREZZA SPRINKLE may prolong the QT interval, although the degree of QT prolongation is not clinically significant at concentrations expected with recommended dosing. INGREZZA and INGREZZA SPRINKLE should be avoided in patients with congenital long QT syndrome or with arrhythmias associated with a prolonged QT interval. For patients at increased risk of a prolonged QT interval, assess the QT interval before increasing the dosage. Neuroleptic malignant syndrome. A potentially fatal symptom complex referred to as neuroleptic malignant syndrome, NMS, has been reported in association with drugs that reduce dopaminergic transmission, including INGREZZA. The management of NMS should include immediate discontinuation of INGREZZA or INGREZZA SPRINKLE, intensive symptomatic treatment and medical monitoring, and treatment of any concomitant serious medical problems. If treatment with INGREZZA or INGREZZA SPRINKLE is needed after recovery from NMS, patients should be monitored for signs of recurrence. Parkinsonism. INGREZZA and INGREZZA SPRINKLE may cause Parkinsonism. Parkinsonism has also been observed with other VMAT2 inhibitors. Reduce the dose or discontinue INGREZZA or INGREZZA SPRINKLE treatment in patients who develop clinically significant Parkinson-like signs or symptoms. Adverse reactions. The most common adverse reaction in patients with tardive dyskinesia, greater than or equal to 5% and twice the rate of placebo, is somnolence. The most common adverse reactions in patients with chorea associated with Huntington's disease, greater than or equal to 5% and twice the rate of placebo, are somnolence, lethargy, sedation, urticaria, rash, and insomnia. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Dosage forms and strengths. INGREZZA and INGREZZA SPRINKLE are available in 40 mg, 60 mg, and 80 mg capsules. Please see full prescribing information, including boxed warning, at INGREZZAHCP.com.